Welcome to Pregnancy and Birth Diaries. Today we'll be talking about something that I had no idea about until just recently, but the fact that such procedure exists is another evidence of how advanced we are in medical surgical techniques. So today's topic is cervical cerclage, a surgical procedure done to prevent premature birth or miscarriage. One of the reasons why premature birth or miscarriage happens is because of cervical insufficiency. This is when the cervix is weaker than normal and it might start to open or to shorten or become thinner earlier than expected during pregnancy. This premature opening is not a natural progression for pregnancy because the cervix is supposed to stay closed and firm to support the growing baby until it's time for birth. But in case of cervical insufficiency, it's like the cervix struggles to stay closed until the baby is ready to be born, which means the cervix begins to dilate or thin too soon and might trigger premature labor, causing the baby to be born too early before reaching full term, before due date, and then premature birth in itself can pose various health risks for the baby because of incomplete development of lungs, other organs, and the nervous system. Now, potential causes of this condition can be multiple pregnancies, previous cervical trauma, surgeries, or congenital cervical abnormalities. So the procedure cervical cerclage is done to prevent miscarriage or premature birth when there is cervical insufficiency. This procedure reinforces the cervix to keep it strong until it's time for birth. There are two main or most commonly known approaches of this surgical procedure: McDonald cerclage and Shirotka cerclage. The McDonald cerclage is a temporary stitch made around the cervix. This stitch is usually made of a strong, non-absorbable material like nylon tape. The suture is placed in the cervix's lower part to provide support and help keep the cervix closed by reinforcing the weakened cervix and reducing the risk of it opening too early during pregnancy. The stitch is then typically removed towards the end of the pregnancy or during labor. In the Shirotka cerclage, on the other hand, a permanent stitch is used to close the cervix by making an incision in the cervix and then stitching it closed for more sustained support. This permanent stitch is intended to stay in place not only for the duration of pregnancy, but longer or permanently. But it doesn't mean that this cerclage can be used for multiple pregnancies and childbirth. For subsequent pregnancies, it is generally recommended to remove this stitch before trying for another pregnancy. Another thing is, since this stitch stays in place during childbirth, when labor begins and it's time for baby to be born, the presence of the stitch does not allow the cervix to dilate normally. And that is why vaginal birth is not possible. So the baby is usually born via C-section. Both these cerclage techniques are performed based on the medical condition and the obstetrician's assessment of cervical insufficiency and risk factors for premature birth. So the choice between the McDonald and Shirotka methods or other methods may depend on different circumstances. Anyhow, this is all I have for today. Please talk to your doctor about all the concerns or questions you may have on this subject. And I wish you to stay well, and I'll see you next time.